Hi, everyone. I'm Jessica Yellen, and I'm excited to be joined by one of my favorite doctors, Dr. Jeremy Faust, the author of Inside Medicine newsletter. If you don't already subscribe, you've got to do that right away. Hi, how are you?
I'm okay.
You've been busy breaking a lot of scoops.
Yeah, it's been a busy time. A lot of people in the government want to talk, but they can't, and they find people that they trust to put it in a light that is kind of fact based, which is what I know you're all about.
Yeah, I think that's why we work together so well. So I am glad to have an opportunity to talk to you because you both understand what the value of these health organizations are in the federal government and the dangers of what's happening there. Um, I think it'd just be helpful to start not with today's news, but just for a moment with setting the scene. Since the Trump administration has been in office, big picture, can you give us a sense of what's happened at CDC and NIH in particular?
Yeah, sure. So, well, the first thing that happened was that we said we're going to withdraw from the World Health Organization.
Right.
That was a major thing that makes the job of our CDC experts a lot harder. So that's a CDC related news item. And then from there, we've had other issues at CDC. We've had this whole blanket comms pause, meaning total blackout of communications, meaning publications from CDC stopped, that data updates, websites that have clinical information like which vaccines are indicated for which age of kid and what's the schedule and then other things like social vulnerability index, which may not be news that we need every second, but researchers are constantly using that stuff. All that went offline. And then you also had the threats of massive cuts, of course, at these places with this deferred resignation program. Over at NIH, the National Institutes of Health, our massive research body that has really two big silos. Intramural, meaning researchers, they live in Bethesda, Maryland, they do research. That's where Anthony Fauci got his start. And then there's extramural, which is they fund universities and other places to do research. And there's been a huge pause for a pendulum, the pause of grant funding. Now it's back. Oh, get rid of your DEI programs. Now maybe it's back. And so it's just been an absolute. Well, maybe we'll see. Now it's just been an absolute roller coaster at those two places in particular.
I want to, there's so much to unpack, but let's just start. I heard today there was one of the big things that happened is that the agencies were ordered to take down websites that had a lot of important information, and a judge ordered them back up today. Can
Right.
you like? It seems to me like from as an outsider, taking down a website isn't that harmful. Wrong?
Yeah, it was actually totally shocking that they did it for starters, and the just the breadth of what was taken offline was really shocking to so many of us. It was not just some Trump sort of narrow ideology. Oh, we're not really into transgender.
Wait, sorry, you froze for me. I don't know about
Oh,
the audience. Is
okay.
that my system?
It
Can
might
you
be on
guys
your
hear?
end. It says your internet connection's unstable, but that's what it says to me on my little thing.
That
Um,
mine is?
it's blaming you.
Okay, it's my fault. Sorry, I asked the question.
No, it's okay. All right, so not frozen. The people are saying great. So, oh yeah, there's just the extent of what was taken offline. Oh God, it was a couple of weeks ago now, or a week and a half ago, was just so unbelievable. It was not just, oh, we're going to take down these websites that have things about transgender youth or something, which again, like, I don't know why that's such a target, but that's what they were going after. It was, they literally got rid of data.cdc.gov, which has just troves of data that gets active all the time. They took down FluServe. This is the national asset that tells us how many flu-like illnesses and influenza illnesses we have in jurisdictions in essentially close to real time. They took down gosh, what else did they take down? I can't even tell you. I mean, they stopped publishing the CDC's flagship medical journal, the Morbidity and Mortality Weekly Report, MMWR, which had been continuously published every week since the 1960s. And so for it to be gone for 2 weeks was just like eerie. It was just weird. So just the extent of it, I think, was so chilling.
Can you help us understand? I get why scientific journals and having these websites are valuable for researchers, but I've spoken to enough people, including you, that you this stuff is actually actionable information you need sometimes in the moment as you're treating people. Does taking this down put people's health at risk?
100% does. There For example, some of these one example that I used was contraception. If you have just given birth and you now want to go back on contraception, that should happen at some point. And you think, oh, the doctor can figure out what to put them on, what to put that patient on. But it turns out that it is really complicated because if you had complications during pregnancy and you have a new, what's called a cardiomyopathy, which is like a disease of your heart, some of these very straightforward choices become dangerous. And so, who can keep track of all that? Who does it? It's the CDC. And so they put up these resources that says to the doctor or the clinician, hey, if your patient has sickle cell anemia or they have this complication during pregnancy, these are the ones they can take and these are the meds they cannot take. It's dangerous. So that would really be an example of like, wow, what do they do? And then there's other things that people like me, I'm in the epidemiology space, even though I'm not, a card carrying epidemiologist, where it's that the real time data really informs choices. And so, for example, knowing how much influenza there is right now really, really matters because if I have a patient and I'm worried about bird flu, I want to know what's the likelihood that it could be regular flu versus something else. So in the clinical space, knowing what's happening in our communities is really important. And it's an area where we made a lot of progress in the past 10 years. The CDC, like their data websites are so much better than they were pre-pandemic. And then it was like, nope, they're gone. Now they're back. But again, scary that that could just happen for no rhyme or reason.
Okay, so I just want to button that by telling people where we're at right now is the court has ordered those websites back up. I haven't seen them go live yet. It just happened shortly before this conversation. So we're going to have to watch for that and then wait to see if people like Dr. Faust find any concerning changes in what is posted.
Well, let me just say that there's been a thaw already. So since whatever it was, a week and a half ago, where the complete blackout happened on a Friday, it was just so crazy. Things have been coming on little by little. There was a bunch of stuff that was down for a little while. Some things remained offline up until today, and it was unclear whether those were based on philosophical things like, oh, they don't yet comport with the Trump administration's view of the world, versus just technical like, oh, there's just a lot of websites and they just haven't gone back up yet, and we're just clearing them just one at a time. So that there had been a thaw, so some of the stuff was back on. Um, I've seen a couple of things up today that weren't up yesterday, but I can't tell you that I know that that's because of the judge order or if that's just because things were thawing anyway.
And will it be easy for people to discern what's changed, if anything, on the websites?
Oh, not easy unless you use like Wayback Machine archives. They're not pointing out like, oh, here's where we used to keep the information that you want. They're not going to tell us that.
So we're going to have to wait for people to investigate that. Okay, let's move into another area, which is you mentioned this Morbidity and Mortality Weekly had been, it's their flagship journal. You all in your industry rely on it for up to date information. It was down for 2 weeks. It's back. There was this kind of quasi controversy that there seemed to be, they quickly published a bird flu study and then took it down. It was called censorship. Red flags were raised by other publications, and then you wrote something different. Tell
Mhm.
us, what's your take? Are they trying to censor information on bird flu or what's going on?
Yeah, so the overall censorship at the CDC is appalling. I'm not going to say otherwise. The landscape is bad. But on this particular issue, what happened last Friday was more of a procedural issue rather than a Trump administration expansion of censorship. And so what happened was there was this paper about H5N1 bird flu that had been slated for publications in late January. When the comms freeze happened, they were still in the process of finalizing some things and it wasn't quite ready, but it was going to go live. They were going to get it done. Then the comms freeze happened, and that piece got tabled, and people thought it's because they don't want to talk about bird flu. But it turns out that it's actually that the MMWR, that's the journal, this is the CDC's journal, they now realize, oh my goodness, we are under so much scrutiny. Everyone's reading us now. It's like the Barbara Streisand effect, where it's like, we don't talk about this thing, and then everyone's like, what thing? We want to hear about that thing. That's the thing we want to hear about. So the MMWR, when it went back online this week, got more reads than it had since like the peak of COVID,
Oh,
where people
wow.
were. right? So it's now they're like, oh, we're big deal now, and so they have to be so careful. And so what I was told by multiple people who know is that that H5N1 paper will come out when they are satisfied that it's airtight, and that basically, you could take this as a criticism. They were willing before all this happened to put it out, not imperfect, but with I would say holes, but just that's how science works. You put things out the best you know, and then a conversation can happen. And I
Right.
think that they're saying, no, not now. Right
We
now,
want to
everything has
vet,
to be
vet, vet. Yeah.
airtight, and so there's no questions. Like so, whereas previously, like they'll accept questions. Now they're like, no, we answered everything.
I
So
get it.
now they are trying to finalize those data so that they can be in possibly this week's morbidity and mortality, which would come out in 2 days.
Okay, so I want to flag for people these are two things to watch for. One is, does the administration comply with the court's order to put websites back? If not, we're in a bit of a constitutional crisis,
Correct.
potentially that terrain. I don't want to trigger that, but just watching for that. And to watch if this study eventually comes out in this journal. While
And,
we're, yeah,
And I was told that there will probably be at least one H5N1 bird flu paper this week. I'm not sure if it'll be that one.
okay, but some,
Um, but yeah, that tells me that, the people who are in charge there, they're being really careful. That's all I could say.
okay. Quickly, because I don't want to waste our time, but I just want to ask you, do you feel, given the current state of play, the country, our public health officials have adequate information to handle any kind of bird flu outbreak there might be? Or if this stuff doesn't come back online, does that make us more in jeopardy somehow?
That's a great question that doesn't have a clear answer. I think that there are some ways in which we're okay. So, for example, every single state has a Department of Health, and they do a lot of surveillance, and those are up and running, and they're doing great work, and they're going to keep telling everyone who will listen what's going on. Um, the data dashboards that the CDC puts together from all 50 states, those were down temporarily last couple of weeks ago, but now they're back up. And so I think that we would be okay in that way. What really worries me is this as part of the WHO pullout, when we pulled out of the World Health Organization, the comms freeze also said that CDC officials could not collaborate with their usual foreign partners. Meaning, like, if there is an outbreak in Uganda of Ebola, which we think there is, like they're not able to communicate with our international partners as usual. And to me, that's just crazy because I'll give you a really good for instance on this. I'm an ER doctor. We have a triage team, right? They're in the front there. Someone comes in and they say, "I have a fever," and they ask every single person the same question: "Have you had any travel anywhere?" And it's a question that matters because if they say, "Yeah, I was just in Karachi," we're like, "Okay, great. That doesn't. Who cares? Karachi's not on our list right now." But the list gets updated constantly by CDC feedback. And
I
so
see.
someone could say last week, "Yeah, I just came back from Kampala." And that would have been information that they would say, "Oh, Jesus, that's where the Ebola outbreak is. We need to do testing."
But can't you check the WHO website for that?
You yeah, but the WHO does not give travel advisories for United States passengers. They don't have
I
any
see.
idea of and we have our own vetting of risk.
I see.
So the triage nurse could be like sitting there Googling, like, oh, this person. But like, what you want to do is have a CDC sending out to every hospital in this country,
These are the
which
like, yeah,
which which places matter.
yeah. Okay, let me move on. I want to just ask you quickly there because there's reports that there's this extreme spike in influenza and
Mhm.
that ICUs are filled in parts of Indiana. I've heard from healthcare workers in Kansas, Kentucky, who also say they're seeing spikes. Is there a concerning amount of influenza right now? How do you make sense of this?
We're having a very bad flu season, but I put that in sort of how do I contextualize what I mean by that? I don't mean bad like COVID early years bad. I mean every year we have flu and it spikes in January mostly, some places later, and some years are better than others. We are having a really bad one. Like I don't know if it's like 2018 was terrible, and I'm not sure yet if we've surpassed that or if we're going to. But it's like kind of like that, and there'll be regional outbreaks, and what will happen is hospitals are full all the time. No one's has empty hospital beds. It's like airlines. You can't just like run a business and have there's a supply and demand. So, but what COVID taught us is that these little surges or big surges can take a hospital that's like okay, we're 80% full, and really make them like shit shows. Sorry. And so I think what's happening in Indiana and other places is oh, this is a real bad outbreak. And I looked at it. Indiana's flu hospitalizations right now is as high as the kind of like the tail end of the COVID Omicron wave. And that was the massive one that came in January of 2022. Um,
Okay.
where hospitals were like dying. We were so overwhelmed.
Okay, so the takeaway is it's a lot, but it's not the end of the world. And it does not mean that it's bird flu. This is the main thing. People are like, because there's flu, it must be bird flu. No.
Correct. We don't know. And then
Okay.
we can talk about our testing strategy, but I'm not sure if that's, I mean, yeah.
Let's move on because a lot of people are asking about NIH funding, and I want to make sure
Mhm.
we get to that.
Yeah.
So the administration has tried multiple ways to freeze funding to medical researchers across the country and freeze grants and loans, well, grants, especially
Right.
from NIH. A judge has essentially twice told them not to do that. They've used some clever legal tricks to say we weren't defying a court order, and now the court's like, you've got to fund um, these grants. Where does this stand? Are people in danger of labs shutting down? Give us the latest.
Yeah. So there's several things that have happened. One, they said no new grants. All the study sections, which is the fancy term for the NIH gets a group together to decide who's going to get an NIH grant next round. Those were all stopped. And so we don't know no one knew. Like things are getting delayed. Like I have friends who study lung disease and they got good scores and they're told, well, we're not doing this right now, so hold on. So they're in limbo. They could lose their labs. They really could because they need grant funding to come through. Then there's, as you said, there was this complete freeze that got stopped, and that scared people because they didn't want to be in violation of an executive order. If you're told you can't spend your money, and literally, I had a friend with this anecdote. She said, "Oh, I'm I'm NIH funded. I use that funding to buy this statistical software that is on auto pay every month. If I don't cancel the auto pay and they don't like me, am I, because she's like not a white male, I'll just say that, okay? That they're going to say, "Oh, you violated an executive order. Your grant is hereby terminated." Like that's literally the fear that some places had. Okay, I think now there's less fear on that, but that's the roller coaster. And then now there's this whole thing last week that happened where on Friday afternoon news dump, they said, "Oh, by the way, NIH just tweeted, and they also had it on their website to back it up. We're going to cap a certain kind of funding uh, much lower than it used to be." So there's this thing called indirect costs, which we can get into. Every institution has a different rate that they get, and they said, you know what? No matter what your rate is, it's now 15% is the cap, and this would and it was supposed to go into effect yesterday. I mean, absolutely insane. If this went into effect, money would stop flowing. People would start getting laid off within days or weeks.
So the judge put a hold on that. Yeah.
Yes. So 22 states. Interestingly, this I was wondering if the hospitals, which do the research, or the medical schools, or whatever, would sue, and it wasn't. And I heard rumors that they might, but then Monday morning came around and they didn't, and 22 states did, and a judge said, temporary restraining on that. So technically, the status quo is supposed to be implemented. But to your point, are they going to?
Right. We don't know. And a number of people are writing in saying JD Vance said that they won't follow the court's orders. I would just offer that I interpret what he said slightly differently, which is they are pushing the boundaries and testing as much as possible, and
Yeah.
they are going to see how much they can get away with. We can't be certain at this point that they will outright defy. Like, so we have to wait and see. The example I give is when OMB issued its memo saying all federal grants and loans are frozen. A judge put a stay on that and said you can't do it. So they rescinded the memo, showing that they are in fact being responsive to the court. They then said, we are now going to do a freeze without the memo. The court ruled on a memo, not on a freeze. So we're going to do the freeze. Then the court stepped in and said, you can't do that either. The fact that they rescinded the memo and tried an end run shows that they're pushing boundaries, challenging the checks and balances, but not yet outright defying the courts. And we're going to have to see probably this week if they do that by cutting this funding and other ways.
And so at the CDC, for example, today, where they said, um, another organization called Doctors for America had sued about the data and the websites, and there was today, I think, yeah, today, long day. Today, a judge said, okay, that has to be halted. Stuff has to go online. And will CDC comply or adhere to the judge? And you have to be in the shoes of these CDC officials. They are probably being told, if you don't do what we say, you're going to be fired. But then this judge is saying, no, no, you have to ignore that. And so I'm busy talking to like a dozen CDC people saying, what's happening? And they're saying, we don't know, but we cheered when we saw it. Literally, I'll just tell you, quote from a CDC official: I saw it, I cheered. I don't know when we're going to be able to get stuff back online. And, looking online again, like there's stuff that's online, but I don't know if that's because the CDC is following that or because that was part of the thaw. And that's so interesting. The lawyers are going to have to chime in.
Uh, I feel like there's much more for us to talk about, but we can do another conversation. I want to
Yeah.
ask you if there's anything we can do to protect ourselves. Like, someone sent me a list of places we can get the information that isn't available about, the American Medical Association has, I guess, a YouTube channel or a website where you can get some information that's been taken down. There's places to get information about contraception, et cetera. How can we arm ourselves to be as safe as possible right now?
Yeah, so I think that retroactively, there's all this Wayback Machine and archives. You have to be a little bit savvy to go through it, and there are a lot of different people archiving stuff, so that we know where to go. Um, if I'm a primary care doctor trying to remember the vaccine series and it's not up online, I probably have a textbook that's up to date enough, or I might check what's going on in Canada. But it's tricky. I think that there's a real effort right now to get that all that data backed up somewhere. Um, I think that the real question on like sort of our safety is really going to come down to if these data freezes are permanent, if the money stops flowing, then it's like, oh, where's our flu shot going to come from? Because again, the flu shot, every year we have a new one, right? We have a new recipe in the flu shot. It's not the same. The flu shot recipe comes from the WHO. So, if we're not part of the WHO, they will not just give it to us.
They can't just slip it to a friend in the US?
It wouldn't be valid. It would just the CDC, we can't contract to make it on a
Science on it.
non-official
Right.
an unofficial channel, and so that official channel is there for a reason. It's for regulatory purposes to keep us safe.
Could we build some sort of bridge just for that data? I guess they don't want to give it to us if we're not going to give them funding. So who knows?
I don't know
Wow.
what they'll do. I don't know what they'll do. What'll probably happen is big pharma will decide what to do and do it themselves, and
And
will it'll
charge them.
essentially and it'll essentially just be a massive gift to big pharma. If, by the way, we can do it. The irony here is the bird flu stuff going on is actually affecting eggs, and I don't know which we use a lot of eggs to get a protein to make the flu vaccine. So the irony is that we might need mRNA vaccines to fill a hole. And this administration sort of like poo-poos mRNA vaccines, even though they're the ones who helped us get it in
Wait,
2020.
so mRNA vaccines don't require any egg.
Uh-uh.
Okay, because it's all okay.
Yeah.
Um, quick question: is it too late to get our flu shot?
No, it's not too late. And in fact, I wish I could get it later in the season than my hospital requires me to get. The flu shot absolutely goes into effect in about probably 5 to 14 days after you get it. And this is not commonly appreciated. Its effect probably maximizes 2 to 3 weeks out, and then it starts to really wane, just like the COVID boosters, they wane. And people who got their shot in like August or September when it first came out, they have less protection. So getting it now, look at Indiana, Massachusetts, the curve is going up, not down, which is, for February, that's a little unusual. So if you got it today, you probably get a ton of protection for February and March, and it's a late season and a busy season, so I would go ahead and do that.
Great. You are such a wealth of knowledge. So I want to remind folks we're watching to see if the stuff goes back up on the CDC website. We're watching to see if those NIH grants get funded and money flows out. And we are getting our flu shots and signing up for Inside Medicine. Anything I missed?
No, that's pretty good. All I need is a full-time lawyer to tell me what's gonna happen in our courts, and I'll be fine.
I know. Well, we're going to have to wait and see.
Yeah.
It's so good to talk to you. Thank you
Likewise.
so much for your advice. And let's do this again soon.
All right, we will.
Okay.
Okay,
Ciao.
thanks. Bye.
Bye.